Good morning, all. I tell you, covering for Dr. Gales, who's taking a much needed break this week. I never realized how much he does across the board public health spectrum to protect the citizens of Montgomery County. And I am living through that vicariously now when I just got the notice uh, early this morning that he was going to be on the call, but then he decided that he's taking a break. He's actually crunching the data behind some of the numbers that we're seeing now with the uptick in cases. And so I have a laundry list of follow-up meetings to cover. But he asked me just to share a couple of points this morning. One would be the case count, and then two, just to briefly talk about the success that we've had with our return to the level of effort of testing that we've experienced since we had a gap from the previous provider. And so with that, yesterday we saw a slight uptick in cases. We had 95 cases. I understand preliminarily that Dr. Gales just sent me an email that went from 95 to 120 cases as of today. The test positivity is still holding for the county at between 2.2 and 2.3 percent, and our case count is still slightly less, around 8.5% per 100,000 residents. Is slightly lower than the state. The state is still holding at 9.6 cases per 100,000 population, and their test positivity rate is at 2.8. And so what Dr. Gales is doing now, he's already reached out to County Stat and our other surveillance team here in public health to begin to look at and assess the data, to look at the hospital bed utilization, to look at the transmission rates, to determine those low, moderate, and high transmission rates, to begin to do an assessment to see if we need to make changes to our current policies or rescind some policies. So he's actively doing that now while on vacation. And so we're going to schedule a meeting this week, hopefully by the time the board reconvenes or we provide an update to council, we can have some baseline data regarding that. We're seeing an uptick of cases for individuals age 30 and over, and a decrease in age 30 and under. So that's what the surveillance data is showing now, as was reported to me this morning. I'm still going through the data. And so having said that, I like to talk about our testing platform and the success that we've had through that. Michelle, if you could share my screen, please. I'd like to show a graphic if possible, or allow me access to share my screen. And so this chart represents our testing, the number of tests that we've deployed in the community, and our average 7-day rolling rate is 5%, but we've actually exceeded that to 11.4 per week. And as you see that there was a dip during the week of August, and we have significantly increased our testing platform. We have the kits available, but we need folks to come in and get tested. And so we are working aggressively with that across all our three tracks. I remind council of our three testing tracks, which are the employee testing track, our community based testing track, and our clinical testing track. And so along those lines, we have continued to increase our outdoor testing venues. We have the Lake Forest and the Randolph Road Bushy Drive CDC trailers active. The Lake Forest trailer testing space has been one of our higher testing space in that community. We are also looking at our data dashboards, and we realize that the impact of COVID has changed throughout the county per zip code. So we're looking at increasing testing in Rockville area. I think there's a pop-up today at the Twin Brook Recreation Center. We're also re-examining our testing capacity for our outdoor platform, realizing that we're moving into our fall and winter months. So we're working with the CAO Mandolino in identifying those outdoor garages that may be available, where we could also obtain, possibly provide heaters to for our testing platforms, realizing that some folks may not go indoor, but would prefer to come indoor and do or a outdoor drive through testing platform. We've heard that and lessons learned from the field. And let me just back up and talk a little bit about lessons learned. So Michael Bask and members from our group participated in the Rockefeller Foundation Testing Solution Group. And this was a um, uh, testing group of individuals across 27 cities, states, and tribal territories across the United States. And we had an initial conversation about lessons learned and about challenges in the field. And one of the challenges that the group talked about, and this was the inaugural testing platform, testing meeting last week, was testing fatigue and COVID fatigue. And so we've been working with our public information office, our comms team, to increase messaging out in the field. And then the second point, the New Jersey Commissioner on Health emphasized, was that we're all in this together. And the county executive stated that last week on the leadership forum to county employees. And I know that as we continue to participate in the testing solutions group or on that platform, we're able to bring more strategies back to Montgomery County, be it testing, be it lessons learned, be it evidence-based practices, and or contact tracing. And I want you to hold that contact tracing notion, because as I go through and I talk about the testing platform, I want to share with you a personal experience about contact tracing regarding a family member who I was notified is testing positive. And so we're looking at those indoor spaces as well, looking at those community recreation centers. We're working with Montgomery County Public Schools and some of their spaces for testing. Dr. Gales has been in conversation with Dr. McKnight, and there were some challenges and or concerns, but Dr. Gales reassured MCPS that when we use those spaces, we not only will offer employee testing, but make it in a safe and conducive manner. And so we're looking at using Argyle Middle School. They allowed us access to Argyle Middle School, and we're going to start off in the parking lot and possibly using the gymnasiums. We actually are targeting larger spaces due to ventilation, so recreation centers, gymnasiums, places where we have at least a 25-foot threshold are ideal for testing based on our analysis for ventilation, etc. Now, let me just pause and just share with you the personal story. I received word yesterday that my father had attended a food distribution point, which is one of the strategies that we are now incorporating with our hub. We're doing testing at our food distribution points, and he got tested. And he got his results back yesterday, and he was positive. And so he had visited. I immediately instructed him to contact his primary care physician. He took my mother to get tested. She hasn't had her test results yet, but he also visited my 80-year-old aunt, his sister, and my 101-year-old grandfather, who's a World War II veteran, and my 100-year-old grandmother, who is predisposed. She has diabetes and she's blind. And so we went through a scenario of contact tracing, going back and identifying those touch points. So for individuals who may be listening on this call, it's very important when you receive a call regarding contact tracing to follow up and share and provide that information as best as possible. It's not being intrusive. It's not trying to monitor your steps. It is to mitigate the risk of transmission in our community. And that's a personal story that I'm sharing because it touched me yesterday, and having been able to understand the science and the data behind it. We don't have a cure. The vaccines have been paused as of this morning, a news story that I saw. So we still need to be vigilant with wearing face covers, maintaining those social distancing practices. He didn't go out. He went to the food bank. He went to Walmart. He went to the doctors. And to make sure that we repeatedly wash those hands, especially when we are in contact with those highly or frequently touch points. I want to applaud our community partners, our LHI, our AAHI, our AAHP. We're pulling together their testing platforms. We're supporting them as well. They're doing a phenomenal job. The American Diversity Group has done testing over the weekend, and they started testing. And so we're looking at those testing times that will make it available for everyone. So we have testing in the morning, we have testing in the evenings, we're testing on the weekends. We're working with our interfaith council and other community partners to increase testing. We're also, again, looking at the data and working with our community testing partners to ensure that if there's any overlap in any particular zip code where there's been frequent tested or repeated testing, that we coordinate that. We want to saturate testing in the community. So if a partner is testing in one space and we see high numbers there, we are targeting community pop-ups in that space, probably the next weekend or somewhere during the following week. Now, this will and may, I will say may increase our case counts, but we're getting folks tested. Folks are knowing their status. We're getting them isolated or quarantined based on their status, and we're further mitigating the risk of transmission in the community. Speaking of our labs, so we followed up with 13 labs, lessons learned from our previous vendor. We've identified those labs that could provide those PCR testing platforms. And so with that, we're able to return to our employee testing in our clinical spaces. We have our developmental disability group online, and we're providing technical support to them, and they're going to start returning employee testing in those congregate living spaces as well. But we're also pausing that to look at those vendors, potential vendors that have the capability to provide those antibody tests and those rapid tests as they become online, and as we work with the Maryland Department of Health to get machines to do the testings, to provide that point of care testing for our first responders and in our clinical care settings. And our ready responders have been deployed for those individuals and those families who are unable to get out and test. And so along those lines, we'll be following up with our Chamber of Commerce. We have a call scheduled next week when Dr. Gales and crowd return to talk about testing those employees. I know that County Executive Elrich has made that one of our testing mandates, that we reach out to those employees, and we're working with our minority health initiatives to look at those construction spaces and those other places where individuals may not have resource or access to testing, and to provide those testing on spot, either prior to their start of their workday or at the end of their workday. And so those are some of the testing spaces, successes that we've experienced. And the last point that Dr. Gales asked that I share with you, that he's still working with Dr. Stoddard and his team to look at regulatory challenges and issues with continuing the schools investigations and our sports investigations. I don't have much on that. He didn't provide me with any additional information when he emailed me this morning. Perhaps Dr. Stoddard can fill that gap, but he is also addressing that. So we're looking at the testing, we're looking at the numbers in summary, to look at strategies, public health strategies to mitigate any further risk regarding low, moderate, and high transmissions. We're looking at the numbers as they continue to uptick to determine if, in fact, there's actually a surge. We're actually holding at our test positivity rate. It has been held at that level for the past 7 days, but we're putting together contingency operations in plan to address and mitigate any of those risks. I'll stop there. I know I've said a lot, and thank you for your time and consideration.
Well, thank you very, very much, Dr. Bridgers. And we don't see you as often as we see the other people in the department, so we do thank you and your entire department for all that you do. But let me say, there has to be very few people in the world who have grandparents who are 100 and 101. I mean, your genes are one of the greatest in the world. I mean, unbelievable.
Well, I contribute that, Councilman McCash, to my youthful looks. So I will share a bit of vanity with that. So
well, Don't tell your grandparents that's what you said. I'm just telling you.
I won't. I won't.
Anyhow, with that, Dr. Stoddard, please. And then we have several council members that want to speak, please.
Good morning. Just a few updates this morning, given our recent talk on Friday. We're over 200 of the late night alcohol sales permits issued. We did do enforcement over this past weekend, and there were 2 places that received citations as a result of physical distancing and face covering, including of employees in at least one circumstance. We continue to look at our enforcement mechanisms. We actually had a meeting with our Chief Equity Officer, Tiffany Ward, on Monday to talk about how we can make sure that our enforcement is done in a racially equitable manner. We talked through all of what we do. Most of what we do is enforcement-based, and complaint-based. But obviously, we know that complaints can come in an inequitable manner themselves. And so we're working to, she's going to provide us some suggestions on how we can improve our equitable distribution of non-complaint-based enforcement to ensure that we're doing things the right way. A couple things I do want to bring forward. Right now, we'll be giving you a briefing later today on the state of our FEMA and Coronavirus Relief Fund spending. We are concerned about the fact that the state of emergency from the Federal Director of Health and Human Services, Secretary Azar, is set to end on October 31st. And we're hoping to see, usually about this time before those expirations in the last several cases, he has extended it for 3 more months. We're hoping that we see that again. Otherwise, that obviously would create significant challenges for our ability to continue to receive federal support on a whole host of issues. But until we see it, we're obviously continuing to be concerned that it will or will not be extended. Similarly, we've been receiving monthly extensions on our food distribution programs, and those have been approved by FEMA on a continuous basis, and we're hopeful that that will continue. Obviously, the concern would be if HHS ends the emergency, so too would likely FEMA, and so that would create significant challenges. And so it's sort of we're waiting with bated breath over the next several weeks to see that they update those things and move forward. Our Community Recovery Advisory Group is meeting tonight. Tonight, we're at 7. We're going to be talking about food security, mental health as well. Obviously, that's an important aspect of what the work that we're doing now as well. Those sessions, as a reminder, are good opportunities for us to receive community feedback on what we're doing on various areas directly from our various different representative groups from across the county, racially and ethnically diverse, as well as our LGBTQ community as well. We are continuing to meet with our non-public schools. We met with them on Friday. They had a lot of questions about our plan review process. To date, we've received 27 plans for review. We've gotten through 15 of those, I believe, and letters have gone out. We're now starting to get some of the 15 resubmitting based on what we've told them for feedback, and we're going to be working through those. We've got a system now where we're getting through, the plan reviews are fairly detailed. They have we have a team doing them, and then they come back together and review their notes and give sort of consensus findings. And so we're getting through about 5 or 6 plans of those a week. We've seen over 120 other submissions for letters of approval and for clarifications, and we're responding to those in an order of 25 or so a week. We did meet with our theaters on Friday. I think we're going to likely try and come to some accommodation for them. We had talked about aligning our approval or plan to do something along the lines of DC pilot completing. I think based on their feedback and where we're at, that we're probably going to give, we're likely to give an earlier go ahead saying, here are the set of rules that we would like to follow. We would not approve it until likely early November, but give them a couple weeks of lead time around circumstances that we would approve so they can begin the planning process for live performances. We're still working through some of those details, so I can't commit to that definitely happening, but I think that's certainly where we're working towards, and we'd like to find an accommodation that works for them. The last thing I will say is we are looking at developing some guidelines around ventilation and filtration. We are meeting with industry experts in the HVAC realm to talk through exactly what that means. We've done a pretty extensive literature review from across the world, because obviously some places in the world have been a little bit more forward thinking on this issue than we have here in the United States. And so looking at what has been developed around the world, we've got a set of recommendations, or at least guidance for businesses and other entities to operate with HVAC systems that we think are largely achievable. But we're going to work with some of the HVAC industry representatives to say, what's achievable with our current systems, recognizing that depending on the age of the system, they're more or less capable of doing certain things. And so that's all I have for this week, and happy to take questions.
Thank you very much. I do know that, and I don't see him on the call now, but Dr. Raymond Crowell was on the call earlier. So, and with that, we're going to ask Councilmember Navarro to please speak, but we are going to do the 5-minute rule. Thanks.
Thank you so much for this update, Dr. Bridgers, as well as Dr. Stoddard. I wanted to actually touch base. One of my questions had to do with, what the president actually said last week in his message to seniors, where he basically said, hey, look at me, I'm considered a senior, no problem. I took this medicine and I'm cured. Everything is great. Everything is beautiful. And, and Dr. Bridger, here you are. You just shared with us a personal story regarding your parents and your grandparents, which, I wish them all the best, that they will, have an easy process and that they will recover very quickly and completely. But I wanted to give you an opportunity to expand a little bit on that message, right? Because here we are, making sure that we continue to, push these messages. As you were saying, there's some kind of, COVID-19 fatigue, and it's understandable. But there's a lot at stake here. And so when we're competing with these kinds of messages from, the very top, from the leader of the country, it holds us back. So, can you expand a little bit on the message that you actually would give seniors in our county regarding the serious nature of this disease, as well as you just said, how important contact tracing actually is, and clear up a little bit this, sort of fallacy that the president continues to perpetuate.
Sure. Thank you, Councilmember Navarro, for that. So in my humble opinion, we continue to review the science, review the data. Testing is very important. Contact tracing is very important for our seniors who may be listening this morning. If you are not available to get tested, or you have a family member who's unavailable to get tested, please reach out to our testing helpline, 240-777-1755. We have already responders. Some seniors may not have access to the internet. Our helpline can assist with that. Our individual already responders do deploy to individuals and family members. Also, I would ask seniors to be vigilant. If there's some concerns about individuals entering and exiting their homes on a regular basis, encourage them to get tested as well. One of the things that I experienced or learned, and just talking with my father yesterday, was going back and talking to not only his sister, but his parents as well. And they may have health conditions or underlying health conditions. I encourage seniors to contact their primary care physician to do maybe a telehealth screening or telemedicine screening if they feel, if they're feeling sick, or if they think they have a fever or cough or any of those COVID-like illnesses. Contact their primary care physician and seek a family member to get help, or contact us at our helpline to deploy one of our ready responders. Those are the things that immediately come to mind, Councilmember Navarro, as I think about protecting our seniors, who are one of our most vulnerable populations.
Mm-hmm. Yes, thank you for that. And in closing, I just want to express my appreciation to everyone who's been working so hard I think that, as it was mentioned, the targeted initiatives are doing excellent work, and I believe that they are actually able to realize the results that we all envisioned. And I'm so grateful and so proud of the work of all of our county government staff, and in particular, these initiatives that have also leveraged volunteers and other people in the community that are really making a huge difference here in our county. So I just want to thank everyone for that.
If I may, I'd like to add to Dr. Bridges' answer to Councilmember Navarro. I think there's some important context to realize. Number one, obviously the president's recovery is tremendous. No one should understate that. But it's not like the 215,000 that Americans didn't want to live, didn't want to continue being. Many of those are seniors, unfortunately, across the country. And so let's be clear about the statistics. I mean, we're talking about many years of flu all combined into one short season. And as it relates to the treatment that the president got, I think it would be poor planning to believe that every single one of us is going to receive the same level of care that the president got. It's very likely he is the only person in the world to have received the combination of therapeutics that he did. Right now, Regeneron has roughly 50,000 doses of their monoclonal antibody mixture. For context, we have roughly 50,000 cases of COVID, new cases of COVID every single day in this country. And so they have enough to provide one dose to 1 day's worth of people, and not certainly a broad array. And then remdesivir is in similarly limited capacities. And unfortunately for many of us, we don't have world-class hospital facilities like Bethesda Naval Sports Center, where a team of doctors will be supporting us as soon as we get exposed to COVID-19. And so there's a lot of things that are working in the president's favor for obvious reasons, but thinking that would be the outcome for every person who became sick, it would be poor planning on our part.
Thank you.
Thank you for that.
Thank you. Councilmember Rice.
Well, thank you very much. And Dr. Bridgers, again, as you heard from Councilmember Navarro and from the council president, we certainly pray for your family and pray for their speedy recovery. I do want to highlight that piece of it because I think that, again, folks need to understand that this virus is still out there and that it still presents a challenge to many people in our community. And I don't think that folks, unfortunately, as we see sports and folks returning to the stands, these are all things that people see, and people going to bars and restaurants, and potentially the opening up of arts and entertainment venues. That actually has the opposite story. It has a story of that, it's now safe to come out. It's safe to relax a bit. It's safe to not worry. And then just as Council Member Navarro said, then you have at the very top, you've got leadership who makes it seem as though there is nothing to fear. Can we talk about the folks that are affected, the folks who we continue to see who are infected with COVID-19, and then also the deaths, right? We don't talk about that either, but we do continue to have people who die from COVID-19 here in Montgomery County. And so from that perspective, what would be your message to the general populace about being vigilant now, especially as we try and get to the finish line, as we get closer, but know that if we slip, we're never going to make it there?
Thank you, Councilmember Rice, for that. So a couple of responses that I have to that is that, again, COVID-19 is a very deadly virus. As Dr. Stoddard indicated, most of us don't or may not have access readily available as the current president had at his exposure, as well as those facilities. We are still seeing data trends that indicate that those high-risk gatherings are family gatherings, house parties, and then some outdoor events that exceed the size total, as you may have witnessed with the president and some of his rallies that he's returning return to, we see a lot of folks not wearing masks. We see a lot of folks not socially distancing. And we haven't seen the data, but the data and history has presented that typically there have been outbreaks or super spreaders at those events. So I ask everyone to still be reminded and mindful of those high-risk gatherings and those high-risk locations, work outside the home, individuals who travel from home, who may come in various spaces or in touch points and not know that they are interacting or come in contact with someone who's asymptomatic. We have the testing platform available. Please get tested. If you are unsure, if you are sick, please follow up with your primary care physician. Indoor retail shopping, I know that there's a need and a return to our commerce, but be mindful of those indoor spaces. We're looking at the data and the science for the ventilation in those spaces. We're working with Dr. Stoddard and his team to assess that, and we're doing that real time. We're looking at the data and the science to guide our response as well as our recovery. And then lastly, I know that we're coming up on the holidays. Be mindful, have a plan for individuals who may visit you. There's nothing wrong, in my opinion, in my humble and personal opinion, to assess an individual's status, if they've been sick, to visit folks, to limit the number of folks you have in your house. I was actually going to visit my parents. I'm scheduled to be on leave next week. I was actually going to visit my parents, but of course I can't visit them now because they are self-quarantined in different spaces of their house. Their house is big enough to self-quarantine, and my father's actually isolating, since right now he is a house index case and is at risk for transmitting the disease to others because he just got notification within that 2 to 14 day period. And so those are some of the strategies and the comments that I would just say in response to your question.
So another just very, very brief question. I know I'm approaching my 5 minutes. I see the Council President. Let me just ask this. Has there been any change to either the morbidity rates for people of color, primarily for our African American community, nor for the transmission rates with our Latinx community? Have we seen any changes in terms of those concerning numbers that we saw before?
So Councilmember Rice, in response to that, I'm looking at data now. We haven't seen a current trend with changes in those respective communities. I know that we had a conversation yesterday with the National Capital Region and the Council on Government to look at yet another data dashboard that will tease out some of that racial and ethnic data that we've been trying to obtain to look at that. We actually had a conversation in concert with Dr. Stoddard and his team. So you can see the collaboration that we're working as far as from an emergency response standpoint and a public health standpoint. But the answer to your question is, I have not, and our team has not seen any data trends that would indicate otherwise than what has been presented before.
Thank you very much. Councilmember Albornoz.
Thank you, Mr. President, and thank you, Dr. Bridgers, for sharing that personal story. It's critically important that we humanize this virus, and so thank you for being a little vulnerable there for the good of the community. And as you heard, our best to your family for a speedy recovery. And I want to start with good news. I had the opportunity to attend the free COVID clinic at Westfield Shopping Center in Wheaton on Saturday, and was very impressed, both with the operation, with the coordination, the on-site customer service that was being afforded to county residents. And just while I was there were 4 different languages being spoken, from folks that were filling out information. I mean, it was a very impressive operation. I did receive a test. It was painless. It was quick. I've already received my results. I am negative, just to put that out there. But I strongly encourage county residents to move forward and take advantage of these opportunities, because it will help suppress community spread and help keep in front of this horrible, horrible disease, notwithstanding the reckless and cavalier comments that are continuing to be made by the president that make us all sick to our stomach, quite frankly. I did have a general question, and this is more generally for HHS, but there is going to be a case before the Supreme Court the week after the election that addresses the Affordable Care Act. And there is every expectation that if things hold, that it is likely that the Affordable Care Act, at least in some form, will be shot down. Have we begun to assess and evaluate what the potential impact would be on the county should the Affordable Care Act, in whether the entire thing or components of it, be scaled back? And what if are we developing a plan to address that moving forward? I know we're uniquely positioned because of Montgomery Cares and Care for Kids better than many other jurisdictions, but still would love to hear some assessment and evaluation.
Sure. Thank you, Councilmember Avanos. I don't have all of the details regarding the plan. I know that Dr. Crowell convened a senior leaders team retreat this past week, and we address potential changes in administration, and if the administration did not change, what would it look like regarding access to care and treatment, specifically around the Affordable Care Act. So we are looking at that. I know that every particular branch is putting together a plan, and to look at how that plan will impact or any federal or state support that we have as far as access to care and treatment. So that's as much that I can share now regarding that. Great question, but I just don't have the details regarding that and how that plan will actually come together. He's supposed to reconvene and ask for a response to his due outs last week when he returns next week.
Thank you. And I should say, I think this is the first time Dr. Gales has been off for over a year. So, and it correct. Sounded like from your description, Dr. Bridgers, it's not much of time off if he's crunching numbers and continuing to work. So
he's texting me as we speak.
I was going to say, yeah. It's just, we're very fortunate to have him here in our county. I will likely schedule a follow-up session before the HHS committee to talk a little bit more about the Affordable Care Act. And I was catching you flat-footed there, so I wasn't expecting a definitive response. I know the administration is looking into this, and I so appreciate those efforts, and that we are planning in advance if, God forbid, some of this goes down, particularly within the midst of a pandemic. So with that, I yield back to you, Mr. Council President. Thank you so much.
Thank you, Councilmember Raymer.
Thank you. Thank you to Dr. Bridgers and Dr. Stoddard for their briefing this morning. First quick question is, actually I'll ask two questions and then I'll just, the responses will be as long as they'll be. The first is, can you share any thoughts about the case increase? It looks like, if I see correctly at the dashboard, that the 3-day rolling average is now about 99, high 90s, the number of cases. So that's a considerable increase. We've gotten as low as maybe the low 70s. So has contact tracing provided any insights? What insights might you have? Secondly, I wanted to just follow up again. I think this may be more for Dr. Stoddard, but the idea of an employer alliance, we did call for that in the July resolution on testing that the County Council passed, and Chair Albornoz and I followed up with a letter. The thought here is to bring together employers, especially in sectors where there are more employees back at work, but to drive out the message about availability of testing, to share protocols for really who needs to be tested more frequently, just to do anything we can do to be supportive and to bring the business community together to actively manage this, in a united way with guidance, resources, free testing, like all of these things. So I've heard a little bit of interest, but I haven't seen any actual, follow up with plans and so forth. And it seemed like something that the Economic Development Corporation and the chambers, might be able to work with us together on. So first, the cases and then the employer alliance concepts. Thank you.
Sure, Councilmember Raymer, thank you for that question or those questions. Going through the case count now, Dr. Gales has noticed since he met with the board last Friday, it seems to be a state trend with the cases are coming out. We're looking at the data now. We're looking at utilization, beds, use, et cetera, the case count. So we are reviewing all the data now. I don't have a definitive answer to state why we see those increases. We're looking at the transmission rate.
Are you saying that our increase is reflected in a state increase as well? Is that what you?
Yes, that's correct. That's exactly what I'm saying. So we see the pattern.
It's across the country too. Every single region in the United States is on an upward trajectory at this point. Okay. Our upward trajectory is slightly less than several other regions around the country. So I guess in that way, we're doing better than other places.
Correct.
But as we get into the fall months, we are going to see, this is going to happen. It does not, there are plenty of things about this virus we do not understand. The fact that it's a respiratory virus and we're going to the cooler months, we are going to see an increase in cases across the country in every place. We can make decisions that will flatten that curve more than other places, but we will see an increase like this. Having looked at the contact tracing data, I see nothing that says it is a particular type of venue that is driving this. I think it is just more indoor interactions, as we have been concerned about from the beginning. Our curve is not, it's not skyrocketing. This isn't like, major breaking news. We are on a slow climb up. The state is on a slow climb up. The Northeast region is on the slowest climb up of any region, but everyone is going up. So I think that's to be expected.
Sure, and just to add to Dr. Stotter's comment, Councilmember Reamer, we are seeing that, and so one of the things that we're doing that I did mention in my update is that we are incorporating flu vaccinations as well as into our testing, because we're looking at flu season as well, and so it's hitting us hard as a community. We are doing our best to mitigate any risk. That's why Dr. Gales is getting ahead of it now to examine those case counts, to look at those levels of transmissions, those areas of spaces, and all the data across the board. And so we're actually doing that right now, real time, as we see those cases begin to uptick. Yes, we are slightly lower than the state and lower than any jurisdictions. So we're triangulating all the data points in the nation's capital region to make sure that we are consistent and lower and maintain a lower transmission rate. So that's all I can speak to as far as the case count, in addition to
before Dr. Stoddard, I just want to say, Dr. Bridgers, we're thinking about you and your family.
Thank you. Thank you so much.
The story you shared is what makes this so difficult and such a hard time. So thank you.
I would also just add to the overall point, though, we're doing more testing too. So I think it's important to understand our test positivity is down to 2.2%, which is very good. I'm not it's not a catastrophic thing that we're seeing this increase in cases necessarily. It's concerning because we're doing more testing. We had a day Sunday, I believe, that we did 6,400 tests as a not just the county government, but all of our apparatus, which is the highest day I think I can recall. The Salute effort did over 700 tests this past weekend. And so we're seeing increases across the board. And I know you asked about the business sector. Dr. Bridges could, talk more about that, because I know he's been leading that effort. He specifically has been helping to coordinate that effort around increasing our testing with our businesses. I know that with the launch of the Microsoft portal, hopefully I think we got a test today. I think we get the product delivered today, is I think the time frame.
Soft launch, yes.
Yeah, and we're doing testing of it through the next week. With that arrival, that will allow a lot of these other things, including our business integration, to move forward much more rapidly. And so that is something that we're very much looking forward to, with being able to, we want to be able to make sure we can deliver the results that people expect of us through a web-based system, as opposed to just being able to do the testing in the laboratory and not be able to report to people effectively.
Thank you. Council Vice President, but I did want to ask one question, Dr. Stoddard, which you triggered my mind. If someone goes to their private physician and has a test done there, do we know that they've had a test there? Is that in our numbers?
So we get the data for, we get that data reflected through, so all tests, regardless of who conducts them, get reported to the state. Any positive result gets reported down to the health department, through that way, and we would know based on that positive result who that person was and where they got tested. I don't know that we get a report that says all the negative tests.
Yeah, that's where they were conducted.
Yeah,
so
I don't think we do.
They want to go to the provider. Correct.
Right.
That
we don't know how many additional negative tests there are.
We know the total. We know the total number of tests conducted.
Correct.
which you can discern from the positives how many were negative from that. But that would be obviously, like, we know that we have, we get a report that says we had 72 tests. We know that we had, 67 cases or whatever
Right.
it was. You can tell what the negative test rate was in that case.
Okay.
That's how you collect your test positivity.
Thank you. Council Vice President Hucker.
Thank you, Mr. President. I'm cleaning up my notes here because many of my erudite colleagues anticipated these questions. But Dr. Stoddard, thanks for all your work this week and especially for your attention to the theaters. Dr. Bridgers, it's nice to see you. I haven't seen you in quite a while since our town halls and the Middlebrook testing. And I'm really glad you could be here to update us so we could thank you for all your hard work behind the scenes. We don't see you every week like we do with Dr. Gales. And I'm so sorry to hear the news about your family. I hope they all have a easier time and a speedier recovery than the president apparently has. But we'll continue to be thinking of you. I loved what you said about saturating testing in the community. I'm glad that we're setting these records, Earl, about the number of tests that we're doing. That's amazing. Congrats to Councilmember Albornoz and Navarro on the success of the Salute project. That's fantastic. I think there's messages still out there, and I'm going to repeat it if you said it, and I'm not sure we can repeat it often enough, that we still need people to get tested whether or not they have symptoms, right? I saw Councilmember Albornoz talked about his testing. I've been tested 3 or 4 times, negative, thank goodness. But Councilmember Albornoz this week was tested, puts it on Facebook. I go to like it. Before I can even like it, somebody says, why are you being tested? Do you have symptoms? I think that mentality is out there a lot. I think it's widespread among essential workers that I talk to all over my district, especially Black and brown residents that, just feel like, well, sort of, I'm good and I feel good and I'm busy and I got a family and I got a work job to do and I don't need to go get, that's just like one more errand. And it's a little bit of an apprehensive errand that I don't really, it's like going to the dentist or something. I'm not really looking forward to it. And there's no urgency. It's not on my schedule. I'll do it sometime, maybe, man, but I don't need to do it now. And I think we need to push everybody past that because, right, do we know what percentage of cases are asymptomatic?
I don't have that data before me, Councilmember.
Many, if
but I can
not
follow
most.
up.
No, I would say the number is between 25 and 50%, depending on the cohort of people that you check, are asymptomatic who test positive. And so
we all have
many.
Everybody else, even if you're not thinking about society, you care about your family and your friend, you might have it, you don't know it, you don't want to bring it home, you don't want to give it to your parents or your kids, and you need to go get tested. We're telling people to vote these days and to be in the census. We got to tell them, no matter how they're feeling day to day, put it on the calendar and go get tested. You've made it available so much more than we had through the work of all my colleagues for months now. There's really no excuse for everybody in Montgomery County to not go get tested and go get tested again, particularly if they've been exposed to anyone or have any reason to think they have. So anyway, I hope that's reflected in our messaging because I feel like in the people I talk to, it's not quite penetrating. People mention COVID fatigue, and I think there's a fair amount of that. And people who feel good need to still go get tested, and we've made it very, available everywhere. I'm glad.
Can I comment real quick on that before you? I think it's really important to understand one of our highest risk gatherings are family gatherings.
Yes.
No one goes to a family gathering intending to expose their loved ones with COVID-19. Much of that transmission is likely asymptomatic transmission. As we get closer to Thanksgiving and the other fall and winter holidays, people need to start devising plans with their families. Like I think we could say don't gather with your families, and look, that would be like saying abstinence-based sexual education, right? We know that people are going to do it. So people should plan to have, mini bubbles like the NBA and NHL did, where you go and get tested. If you're going to be with your family, think about how you're going to plan out to make sure you minimize your exposure. So when you get together with your family, you're minimizing that opportunity for transmission. The same is true of family gatherings that are happening every weekend throughout our county right now. So please get tested. If you're interacting with people, even if they're people that you know and love, that is even more reason that you should be testing yourself and asking them to be tested, so you're not exposing your aunt, your grandma, whatever, to illness.
I'm so glad you said that. I looked carefully at the graph about where you're testing. I was going to ask about family gatherings and what the contact tracing is telling us. Thank you for that. I wanted to also ask about congregate care facilities. Since there's so much of our testing, they've been so much of our cases. The state now allows the visitation at the nursing homes, which, around the state. I wonder if we're seeing any upticks there. I mean, I can see the dashboard, but if you have any comments on that or anything else that we would like to see the state be doing, because their conduct on this hasn't been exemplary exactly.
So a couple of pieces. I just want to respond to or add to Dr. Stoddard's comment. Yes, have a plan. Have a plan. We talked about those mini pods. As a matter of fact, Dr. Gales and I talked about, or we shared our plans. And the other piece is we haven't seen any upticks. We're working with our aging and disability service branch. Their visiting nurses are going back into the nursing homes and those assisted living spaces. So we're going to get them trained. We're going to get them tested. We're going to provide kits. We're working with Dr. Greenberg, and I know I'm talking really fast because I saw Councilmember Katz give me the 5 minutes.
Well, no, you don't have the 5-minute rule. My colleagues do. Not you all, believe me.
And so to answer your question is, yes, we're looking at those spaces. We are returning. We are providing them with the kits. We have the kits. We have the platforms we need to get folks tested. Our ready responders are available to go in those individual spaces. But the message should and is that, I think Cindy Edwards said this early on, back maybe in July, we need to act as though everyone we interact with that's outside our home is symptomatic. Plain and simple. Get tested, know your status, and then maintain those 3 things: wearing a mask, social distancing, and repeated hand washing. And I'll stop there.
Good. I'm glad you said it. My time's up. I just wanted to second the interest in the ACA case. Look forward to the HHS session. We'll have Maryland, Montgomery Cares and the Maryland all-payer system. We're really going to have a unique reaction to this. So I'm really eager to hear about the planning on that. I know you have a lot on your plate. Thank you, Mr. President.
Thank you. A couple things. I just received a text from someone that said that they were a patient in a hospital and that they were tested, but that the hospital staff was not tested. I'm assuming that is not accurate. Do we know how often a hospital staff member would be tested?
So,
yeah,
go ahead.
No, go ahead. No, I was going to say, I mean, it will likely vary to a degree by hospital, but hospitals do their own in-house testing, and it would greatly surprise me if they weren't doing routine employee testing. We could, that's something that maybe Dr. Bridges knows, but we could follow up on that.
Yeah, no, I agree. They should be tested. As a matter of fact, as part of our clinical test track, we were working with the area hospitals to provide them test kits to support their testing platform. We have and are revisiting that. So we have made kits available to them to test. And so we're having those conversations with those hospital executives to make sure that they not only get the test, but be able to test their personnel as well. So yes, we are testing them. We gave them test kits, and we're revisiting to see how many they need now. And so that seemed highly not probable because they should be tested on a regular basis as well. But we don't have that information, only the positive results as they come through from the state.
If I get any updates, then I will let you know as well. And also, can you please state one more time where people can get where the locations are for people to go get tested, or where they can find that information?
So if they visit our COVID Montgomery County testing portal, we have the schedule out for all of those testing spaces across all of our partners. They've listed their test scheduling there. We also have information about our ready responders and how to engage them and request for their support, as well as our COVID testing information number. And I will say that again, 240-777-1755. All that information is on the county's COVID testing portal webpage.
Very good. And if right now college students are going to come home for the holidays, and then some are going to stay and not return to school until January. So what should a family do in that situation? should that student be tested as they come into the home? What is the, and I see a college student parent shaking his head, but is that what people should be doing? What is the best way to be safe?
So again, another personal story. I have a college-age son who just graduated and returned home. And every time he leaves the house for any extended stays with his friends, extended stay would be more than 2 to 3 days, he has to quarantine. He has to quarantine until he gets a test, until we receive those test results. And if he needs to walk about the house, he needs to wear a face cover, because we realize that the face cover prevents the transmission of the disease. And so those are some of the practices, those personal practices. So to answer your question, upon return, most universities have a testing plan in place. But if they return home, I think it's very prudent that those individuals, those college-age students, get tested so that everyone in the house can know their status. And it doesn't hurt as well to go as a family to get tested. So those are some of the suggestions and personal recommendations that I have. Dr. Stoddard, you may have some.
I now understand why your family has lived to be 101 years old. If you're that careful with your family, and you're absolutely right, obviously, but not everyone would do that. I mean, that's the reality.
So in my home, this is a community of practice. Just as we're talking and sharing information, this is a community of practice. It will take all of us to stem this virus, to mitigate any transmissions. And so some of those things that I can actually talk about on this call, I have lived vicariously through that. And so you may not see me, but I'm sharing and talking to Dr. Gales some of those real-time practices and experiences that we see in many communities, especially in Montgomery County.
Thank you all very, very much. Thank you for being with us. We know you have to Zoom somewhere else at this moment, but we thank you for being with us. And there again, thank you for everything you do. We wish everybody's family be safe and be well. Thanks.